talk with you a few minutes about a problem. Would you believe that a brown spot could kill somebody? Would you believe that pigment on the skin could kill someone? The answer is that probably 1 out of 100 Americans who die of cancer die because pigment has killed them. It may have been pigment that came from a simple little brown spot on some sun-damaged areas. It may not have even been sun-damaged. But it was a brown spot once, and then it began to undergo some changes. And what I want you to do is make you aware of the problem, of the fact that brown spots can kill people. But it's more complicated than that. I'm not trying to tell you that because you have a brown spot it should be removed, it should be submitted to the laboratory. What I'm trying to tell you is that there are people who come in here that have a lot of brown spots on them, and they're not going to be killed by these brown spots. Probably in a day's time I might see as many as 500 brown spots, and maybe more. It seems like sometimes at the end of the day it is more. Which of these brown spots might kill somebody? Which of these brown spots might maim somebody? Which of these brown spots might be important? And that's what we want to try to teach you today about, first of all, what to look for, what to notice, and what to do. First of all, there are a lot of good publications that are put out. One of the first ones that came out was put out by the National Institute of Cancer, and it showed what normal moles look like, and then moles that were abnormal, which we call dysplastic, and finally then moles that were malignant melanoma. Every dermatologist's nightmare, and every patient's nightmare too. Nowadays you can get on the internet. E-medicine's a good place. It's E and then medicine spelled all together like one word, and you can look up malignant melanoma or dysplastic moles, or the medical word for a dysplastic mole is nevus, N-E-V-U-S, or plural is N-E-V-I. Also, a simple condensation, which is put into words, is a sheet here on examining for abnormal moles, which I give to my patients. But there are all sorts of items on the internet that you can find that go into details like this. It's very important to familiarize yourself with what brown spots, freckles, and moles should look like and what they should not. What I'd like to do is show you a situation where somebody has something called a seborrheic keratosis. A seborrheic keratosis is a growth that can look like a malignant melanoma, it can look like a mole, it can even look like a skin cancer, and yet it can be entirely benign. At the same time, you can have a melanoma that looks like a seborrheic keratosis. Incidentally, we don't call them seborrheic keratosis in ordinary use, we just call them SKs, or warty sun damage spots. Anyway, these SKs are places which are big foolers, and they're the reason why we might see 500 or more brown spots or warty spots or black spots in a day's time in seeing patients. A decision has to be made about these spots. A lot of times tissue has to be submitted to the laboratory. Quite often people go to a doctor's office and they're frozen off, and personally I don't do that. I think if you can't get rid of it chemically, it needs to be re-looked at and submitted to the laboratory. Some of the reasons that 1 out of 100 Americans die from cancer that is related to pigment, in other words malignant melanoma, is the fact that things were either burned off or frozen off and they were not submitted to the laboratory. So we don't want that mistake and problem and tragedy to happen. So we're going to show you a few little tricks to try to get rid of these places, and if they don't respond, then we move on to biopsying, assessing, or maybe re-encouraging you to use the chemicals again. Here we have an individual who's unfortunate to have what are probably seborrheic keratoses. She is blonde-haired, blue-eyed, and has very fair skin. These particular brown spots, and if you'll notice this is more gray and this is light tan, and then we have through here areas which are very thin, fine, scattered. These are all characteristic of seborrheic keratoses. Are they seborrheic keratoses? I don't know. They probably are. But if you'll notice over here, we've already painted on some salicylic acid. And what she'll do over the next 3 months is try to get all these lesions removed by using salicylic acid. Of course, the first thing to do is find out how well she tolerates salicylic acid, so that's why this has been painted on. If the salicylic acid's been tolerated well, then there's the salicylic acid sheet or protocol that we give people so that they can follow the instructions, because if you're treating seborrheic keratoses around the neck, it's totally different from the back. You have to be sure you're not sensitive, but the neck's more sensitive than the back is to treatment. In 3 months, if they're not gone, then these places need to be biopsied. On the other hand, if they begin to become red, raw, sore, or tender before then, she needs to stop the medicine, call us. A little bit of redness, a little bit of soreness, a little bit of erosion, or looking like it's been scraped on the sidewalk, that's good. But it's the excessive amount that becomes a problem. So I wish her nothing but good luck, and I hope in 3 months I don't have to be looking at her back again. I hope she's all clear and looks just totally beautiful from this. I would like to show you on my own hand a particular place where I had some places that were as big as these spots, and if you can get the brown spot down to essentially like this, and there's not anything that is seen very easily, then that's wonderful. Now, the dry skin's from washing my hands between patients, so don't pay attention to that. It's these brown spots I'm talking about. Before I was mentioning seborrheic keratoses, or SKs as we call them. This is an example of a seborrheic keratosis, or SK. Here are some very faint seborrheic keratoses that are just beginning. All of these actually need to be treated with salicylic acid or aspirin type of compound for the purpose of getting rid of those. Unfortunately, there is another area, we won't show it today, but that has failed on this individual to disappear, and so the individual's in to have that particular area removed. Today we have a fellow who unfortunately has had malignant melanoma. He's very careful about watching his brown spots because he knows that brown spots can unfortunately be a source of problems, disease, and actually could possibly kill somebody. So he's on the ball watching places. He actually had come in this morning for another place that he had spotted on his back. The day before we started the surgery, he said, "What about this area right here?" And it certainly looks irregular enough to warrant removal, especially since he's had a malignant melanoma. Next to it is an area that I've got a question mark drawn in. This has been photographed because we're going to watch it. The way we're going to watch it is I'm going to get him to use some acid on this area, and if it doesn't remove, then he'll be back here and we'll be wondering what needs to be done. As I move around, you can see another place where he needs to do some work, which I'm going to have to point out to him in a few minutes. On top of that, he's pointed out some places to me on his legs. But before we look at that, I want to show you a place on his back. Now, it's been marked out for surgical removal, but this area looks fairly nondescript. It's brownish. It really looks like it could be just a sun damage spot, and you see these many other areas around that could be equally so. This has already been biopsied, and we found out that it is a mole. It's growing abnormally, and today it'll have to be removed. The strange markings here are what has to be done to move the skin in to close this area when it's removed. Here's a typical area that he can use salicylic acid on, and it should be gone within a period of several weeks, or in some cases months. This is the primary place he's concerned about, but he has a few other little brown spots. He's very, very diligent about getting these places gone because he knows that if they don't respond, they could be a sign of an abnormal mole or even a melanoma, which would be his worst fear and my worst fear.